Hello, future nurses. I'm Professor Vidalis. Today's skills that we're going to cover are Foley insertion and removal. So when your patient needs a Foley inserted, an indwelling urinary catheter, it's due to several things. It could be because they have urinary retention, obstruction, maybe they're getting surgery, maybe they are immobile, perhaps they have severe pressure injuries, maybe we need to monitor their intake and their output, so their urinary output. There are many reasons why you would be why the patient would need to have a Foley catheter inserted. So for today, we have Miss Danielle Adams. She is actually post-op, so she had surgery, and she had a Foley. It was removed after her surgery, so they put in a Foley for her surgery, and then they removed it. But now she's having urinary retention, so she has not voided in more than 6 hours. So that is a huge concern. She is retaining that urine. So in order for further complications to occur, the doctor has put in an order for a Foley to be inserted. So before we start, you want to verify your provider orders. So for Ms. Adams, Dr. Forbes has ordered an indwelling catheter for post-op urinary retention be inserted now. And then we also have to obtain a UA or a urinalysis at the time of the Foley insertion, so that way they can see if there's any infection. Okay. One of the complications of having an indwelling urinary catheterization is a CAUTI. So a CAUTI is spelled C-A-U-T-I, and that is a catheter-associated urinary tract infection. So we are usually very cautious about inserting the Foleys because you're potentially introducing bacteria. So, and we're going to show you today how to do a Foley while maintaining sterile technique. Okay, so a Foley insertion is a sterile procedure. First off, we verified our orders, so now we're going to get our supplies. So I'm going to get my supplies from my supplier. So we're going to have our Foley kit. So each Foley kit depends on where you work. Each Foley kit's going to have different supplies, but this kit's going to have pretty much everything that we need. We're going to get some bath wipes. So these bath wipes are going to be used for peri-care. So we're going to clean the perineal area prior to insertion because we want to make sure that we're removing all of the bacteria, any skin flora around the area, the perineal area, so that way we're not introducing bacteria into a sterile environment, which is their urethra. And then I'm also going to get the stat lock. So the stat lock looks different depending on which facility you're at, what supplies they get. It's going to vary, but the one that we have here is the stat lock, and that will be placed on the thigh after the Foley catheter is inserted, so it is stabilized and it doesn't move all over the place. And also because our patient is allergic to betadine, we are going to be using our simulated iodine betadine swab sticks, which are actually alcohol. So make sure that you do not use betadine on the mannequins because it will stain their skin. So that's why I say they're allergic to the betadine. So please make sure that you are aware that you would not use alcohol swab sticks on a human. This is just for the mannequins that we're using them, okay? Alright, so I'm getting all my supplies. I am coming into my patient's room. Knock, knock. Hi, Miss Adams. Yes, hi. I'm Cynthia. I'm your nurse today. So Dr. Forbes has ordered a Foley to be inserted, okay? So I'm going to go ahead and get all of that ready. I'm going to do some hand hygiene before I get started, okay? And then get some gloves, and then I'll explain everything to you. So I'm going to do some hand hygiene, because you always want to make sure you do hand hygiene before and after all your procedures, and before entering the patient's room and before leaving the patient's room. And then I'm going to get my non-sterile gloves, okay? Get my supplies. And on the patient's bedside table, I am going to wipe that down with my germicidal wipes. Okay, make sure that you wear gloves when you use these wipes, because they are very strong antimicrobial germicidal wipes. So I've wiped down my table to make sure it is clean. The bedside tables get used for so many different things in the patient's room, so you want to make sure it's clean. So, first off, Ms. Adams, we are going to do what's called peri-care. So I am going to clean your perineal area and with some wipes. So it's just like soap and water wipes. But make sure that depending on your facility, you use whatever is appropriate. Some facilities might use CHG wipes, which is chlorhexidine gluconate. Others may just have regular comfort wipes or bath wipes. Alright, so yes, I'll be cleaning your perineal area and just making sure that we're removing any, any flora, any debris, also making sure that you haven't had a bowel movement, and we'll clean you off first, so that way we're not introducing that bacteria into your urethra, which is a sterile environment. Okay, so we'll be doing that first, and then I'm going to be inserting the Foley. You're going to feel some pressure, but you'll feel some relief once that Foley is in, once the catheter is in your bladder, because then that urinary retention will be relieved, okay? So before we start, we have to verify that we have the correct patient. So to do that, we are going to come and look for her ID. So, let's see, ma'am. Can you please verify your first name and your last name?
Kenya Adams.
Okay.
December 17th, 1971.
Okay. So we have the correct patient, and I'm verifying that against the orders. And can you tell me if you have any allergies?
None.
None? Okay, perfect. So it's very important to assess for allergies. Specifically for this skill, we are looking for if the patient has any betadine allergies, iodine, shellfish, latex allergies. Sometimes banana allergies and kiwi allergies can counter or cross-react with latex. So all of those things are very important to make sure that the patient is not allergic to. And just in general, we always, as a standard action, we always verify for allergies, whether medication or other things, okay? So once we have our patient identified, we're going to provide privacy, so close the patient's room. Some rooms may have a curtain, so you can put the privacy curtain, because you are exposing the patient. So you want to make sure that the patient has all the privacy in the world. I need to make sure that my trash can is nearby. So I am right-handed, so I'm going to go on the right side of the patient, and to be able to do all of this. Alright, so now that I'm on the patient's right side, make sure that your trash can is nearby, and you want to bring your table over with your supplies, okay? So we're going to bring the patient's bed up, because again, back safety is very important. Make sure your table is not going to hit the bed. So we're going to bring the bed to waist height, because again, you don't want to be bending too much because it's gonna hurt your back. Back safety is very important. Make sure you're practicing good body mechanics when you're doing patient care. Okay, that should be about right. So, Ms. Adams, for this procedure, we're gonna keep you laying down flat. If you do get a little short of breath or anything, we can bring that head of the bed up just a little bit, just to make you a little bit more comfortable. We will have to put into consideration, do you have a patient that might be overweight, where they have maybe a little bit more abdominal tissue? So in those cases, that will be covering the area that you need to work around with. So you can put the bed in a reverse Trendelenburg. So you're going to tilt it a little bit to where their head is a little bit lower than their feet. But in this case, we don't have to do that. So Ms. Adams, so what I'm going to do is, let me put my gloves on, and I'm going to get Ms. Adams ready to go for the peri-care. So I'm just going to bring the covers back. Alright, Miss Adams, I'm just going to pull your gown up just a bit, okay? And just expose what you need. Don't put the gown back all the way, okay? So, we're going to start off with the female insertion. That is more complicated than the male. So, we will go ahead and get our bath wipes, and you're going to do one wipe per swipe. So the way we're going to clean our patient, okay, so I'm just going to grab the wipes like this, okay, so your both hands, I'm going to use my dominant hand to hold the wipe, and then the non-dominant hand I'm going to use to hold that labia open, okay? So you have the labia minora and the labia majora. The labia minora is inside here, and then the labia majora is external. So we want to get inside the two labia minoras because that's where the urethra is, okay? This is the site of insertion where the Foley catheter is going to go in through. So the first wipe that you're going to use is going to be, you want to start distal, and then do proximal, and then down the middle, okay? So we're going to start from top to bottom, one wipe. We're not going to go back up. So top to bottom, one wipe, top to bottom, and then we come across, come around, okay? And then I'm going to get a new wipe. Now we're going to clean proximal, so the side closest to me. Top to bottom, one wipe, first wipe, and then throw that away, get a new wipe. Now I'm going to clean the middle, okay, the medial. So the middle is going to clean the urethra, okay? So make sure you're holding open the labia with your index finger and your thumb, or this way, whatever works for you. So one wipe, top to bottom, down the middle, and then throw that away, get a new wipe. So now I can let go. So now I'm going to clean down from top to bottom, down the groin, okay, new wipe, top to bottom, down the proximal part of the groin. So top to bottom, so down to the buttocks, okay? And then I'm going to get a new wipe and then clean the upper thigh, top to bottom, okay? Get a new wipe. Now it's going to be the proximal upper thigh, top to bottom. Get a new wipe, and then you wipe down the abdominal region, okay, or lower abdominal region. So get another wipe, and if you need to, get another wipe and wipe down a little bit higher. So essentially you're cleaning this whole region, so you're getting rid of all that skin bacteria, whether it's healthy, normal flora or not, okay? Especially if your patient is not getting showers or baths frequently, all of that dirt, those microbes accumulate, so they can increase the chance of the patient getting a UTI with that skin flora in that area when we insert that Foley. Okay, so now we are done with the peri-care. So now that I've finished with peri-care, I'm going to remove my soiled clean gloves. Move this out of the way, or throw that away, because that should be empty, depending on how many towels or how many wipes come in your kit. And then I'm going to do hand hygiene and put on a new pair of clean gloves. Doing okay, Miss Adams?
Yes.
Just make sure you're keeping your patient safe, because that bed is really high. We don't want her to fall. And what you'll also want to do is put that side rail down, so that way you can get close to your patient for this next part. Okay? So I am putting on clean gloves to open my Foley kit. Okay? The kits come in different sizes. So catheters, Foley catheters, come in different sizes. So this one is a 14 French, which is average for a female. They're different sizes, so usually 14 females and males. 16 French is a little bit bigger, and 18 French I think is as high as it goes. With Foley catheters, the higher the number, the bigger the catheter, which is in reversal to the needle sizes. So with needles, the gauge size, the higher the number, the smaller the needle. So remember, with catheters, with Foley catheters, the higher the number, the bigger, the wider the catheter. Okay, so always look at that, and then also make sure that if your patient is allergic to latex, that you get a latex-free kit. So you always want to verify. You always want to verify what supplies are found in your kit, and that will be found on the outer packaging. Okay? Alright. So to start, we are going to open the Foley kit. So you're going to see a little arrow on the edge. So you just pull on that, and it will open across, like so. Okay? I'm going to keep this packaging because I'm going to use it as a trash receptacle. When you remove your catheter kit from the packaging, you're going to see the shininess on the drape. Make sure that nothing else, that you don't touch anything else before you're sterile. And I'm just going to fold this up and throw that away. So that way it stays open and it doesn't collapse. And this you can put at the foot of the bed, so that way you're not reaching over. Once I'm sterile, I can't put my hands below my waist or touch anything that is not sterile. Alright, doing okay, Miss Adams?
Yes.
Okay, still doing good. Alright, so this we'll throw away. Okay. So notice how the Foley kit has a pointed or a triangular shaped flap. Okay, make sure that is always facing down, because this is the flap that I'm gonna open first, so it needs to open away from me. And then you'll have two flaps, left and right, so you'll open it to the sides. And the last flap that you open will be closest to you. So that way we're not reaching over once our kit is open and exposed, and thus contaminating our sterile field, okay? So I'm gonna touch just the 1-inch margin to make sure that I am not contaminating inside the sterile drape, okay? So I'm opening it away to the side. I can move my table a little bit so I don't potentially contaminate with the sheet. And then open it this way. So make sure the drape stays closed, or open, sorry, so that way it doesn't fall back onto your sterile field. So this is what the Foley kit looks like when it's open, okay? So it's going to be in a diamond shape, so I am going to carefully, by only touching the 1-inch margins, which are considered not sterile, I'm going to adjust this, making sure that I'm not reaching over my sterile field. Okay. And adjusting it so your drape kind of makes a rectangular shape, or a square, more of a square shape, okay? So for this next piece, I am still not sterile, okay? However, you need to, when you're touching this next drape, you need to be as sterile as possible, observing your 1-inch margins. So, for this next part, I am going to carefully pick it up. So this drape is going to have a shiny side and a non-shiny side. The shiny side will be facing down. That drape we're going to place underneath the patient's buttocks, okay? And also important to note is your kits will usually have the supplies in the order that you're going to use them. So since the next step is to place this drape, that is why it's on top, okay? My sterile gloves will be underneath it, prompting me to become sterile. So I'm just grabbing it by the 1-inch margin carefully, okay? And I'm going to step back from my sterile field because I don't want to contaminate anything that is sterile that's in my kit, okay? Notice how I am grabbing my sterile drape strictly by the 1-inch margin, just by the corner, okay? You're going to see a shiny side and the non-shiny side. If you need to tug at the bottom to straighten it out, you can do that. Just be very careful not to contaminate. And once I have it stretched out, I also want to make sure that I don't turn my whole back to my sterile field, because if something contaminates it, I would not be able to tell. So then I'm going to lay this down and carefully place it between my patient's legs. Okay. And it's actually going to be better if you have your patient with their legs open like so, so that way you can place your drape and do everything that you need to do. I neglected to do that at the beginning, but that's okay. Now in some cases your patient might not be able to hold their legs bent like this, so you can get help. Okay, and I'm adjusting this without contaminating the middle. So never touch the middle because that is sterile. Don't touch it with your non-sterile gloves. Okay, now that that's on there, we're going to put on our sterile gloves. Okay, so I'm going to remove my non-sterile gloves, and then I'm going to do hand hygiene. And I am going to remove the gloves that are in my kit. These are usually mediums, if your hands do not fit into these gloves, you can get custom sizes or sizes that are more appropriate, like small, medium, large, and extra large. So just check with your facility's policies or supplies. Alright, so I am going to move this table to adjust it so that way I can use this portion of it to open my sterile gloves. Because if I open it this way, I am going to contaminate the sterile field. So that's a big no-no. We would have to start over. So I am opening it up like so. And you want to open it kind of like a book. Okay, your wrapper here is going to have 1-inch margins also. So again, you can touch the 1-inch margins with your non-sterile hand. Once you are sterile, you cannot touch those margins. Still doing okay, Miss Adams? Alright. Okay, so when you're putting on your sterile gloves, there are some rules that you want to follow. So you're going to see the cuff inside is going to be folded. It's like the inside part is folded over to the outer cuff, okay? So with this is considered not sterile. All of the exterior of the glove is considered sterile. Alright, so this is not sterile, this is sterile. So when I'm picking it up, I am going to pick it up with my left hand, which is my non-dominant side. So see how I'm picking it up by the inner cuff, the lower part of the inner cuff, because this hand is not sterile, so I need to touch non-sterile to non-sterile. You just have to be careful because sometimes they are a little bit stuck, so you have to try to separate it, okay? So I'm going to pick it up with my non-dominant hand, taking a step back so I'm not messing around with my sterile field, and I'm going to slide my non-sterile dominant hand into the glove, okay, of that right hand. So you'll see the thumb is always going to be on the exterior. So you always want to put your hand in that direction. So I'm going to pull back on the cuff without touching the inside or the exterior, I guess, at this point, because this is sterile, okay? Again, you can touch sterile to sterile and non-sterile to non-sterile, but not non-sterile to sterile, okay? So this hand is now sterile. So because my gloves are sterile and this part of the glove is sterile, I can touch sterile to sterile. I cannot touch this hand, sterile hand, to the non-sterile part of my glove, okay? So just keep that in mind so that way you don't confuse yourself. So to do that, I am going to carefully, using one of my fingers, I like to separate the cuff here so that way I can slip my fingers through that inner cuff. It forms a pocket. If your gloves are really stuck on there, you can lift the wrapper from the bottom so that way your gloves don't slide out of the wrapper, because then you're going to contaminate them and then you have to start over. So I'm picking it up using my 4 fingers that are sterile, so I'm touching it sterile to sterile. Notice how my glove is sticking out. I don't want to contaminate my sterile thumb with a non-sterile glove, or when I'm sliding my other hand in, I don't want to contaminate. So I always like to stick that out like I'm hitchhiking so it doesn't get me in trouble. So then now I'm going to slide my left hand, so the thumb is going to be on this side, so I keep my thumb on this side, and it's going to slide right in, okay? And as I'm placing the rest of the glove on, I'm making sure that my hands are staying inside or touching just the exterior of the glove, okay? So now I am completely sterile. I cannot touch the bed, I cannot touch the table with my sterile hands. So I'm gonna have to use my feet a lot in order to adjust, okay? So for this next part, I am going to get the rest of the supplies ready. Okay, I am going to just gently move that out of the way just by touching the inside. The inside of this wrapper is still considered sterile. Remember, I can't touch the non-sterile 1-inch margins. Okay. So for this next piece, I can now touch the inside of my kits. So I'm going to rearrange a few things. So with this particular kit, you have 2 trays. You have the bottom tray and you have the top tray. So I'm gonna need to separate them both. So in order to do that, I'm just gonna shift the big box, the bottom tray, over, just making sure that I'm within the 1-inch margin. And then I'm gonna set the tray, the top tray, right next to it, again, making sure that I'm within the 1-inch margin. Okay, so on the top tray, we have our fenestrated drape. So the fenestrated drape is gonna have a diamond shape in the middle. So now that I'm sterile, I can touch all of this freely. I don't have to be careful, like in terms of just touching the 1-inch margin. You still want to be careful, making sure you don't contaminate anything, but this is similar to what your fenestrated drape will look like. Again, each kit, each brand's gonna look a little different, but for the most part, this is what it'll look like. Okay, so the fenestrated drape does not have a shiny side, so it doesn't matter which side you use. Okay, and this is going to be brought over to the area of the patient, and you're going to place it right over the genitalia, whether it's the female patient or a male patient. Okay, and it's an extension of your sterile field. So you want to make sure that you don't touch the bottom of this fenestrated drape, because it is now not sterile, because it has already touched the patient. You also need to avoid touching the 1-inch margins, because they are not sterile, if you need to make any adjustments. But just try not to touch it as much as possible. So now I'm going to get ready to prepare the rest of my tray. So you're going to see that you're going to have a 10 ml or 10 cc sterile water syringe. So this is going to be used to fill the catheter balloon at the tip of the catheter. And you're going to connect it, make sure this is not contaminated. Now you don't touch it with your gloves or anything, even though you are sterile. It's going to go into this port. So this port is going to be the different colors. It's going to give you the size. So this one has the 14 gauge on there, or 14 French, I'm sorry, 14 French. And it's strictly for the sterile water to fill the catheter or the balloon. Okay, so we no longer test the catheter tip. We always just connect the sterile water to it, and then we're also going to remove very carefully the catheter, because we're gonna need to just throw that away. Make sure that if you do throw anything away, you do it from above your waist. You don't want your hands to fall below your waist, because then you have contaminated your sterile field. So for this next step, I am going to get the lubricant. So again, depending on what your kit looks like, your lubricant might be in a syringe, or it might be in a little lubricant packet. So I'm going to spread the lubricant on the tray here, okay? And I'm just simulating it for you, but it's going to go in the tray. And I am going to set that aside there. And I'm going to lubricate that catheter tip very generously because I want to make sure that it slides in gently into the urethra. And then I'm going to set this to the side and back into the box, okay? And then since I do have to collect a urine specimen, I'm going to get this urine specimen cup ready. So I'm going to place it into the box so I can bring everything over into the box. So this particular kit is going to have cotton swabs and the iodine pack. So with this piece, you would open the package and then spread it over the cotton balls. Just be wary that with the cotton balls, you can get some of that, the lint. So you want to make sure that it doesn't go inside the urethra, which could cause infection or potential for infection. In this case, we are going to have our swab sticks. So our swab sticks are going to be non-sterile. So we would have somebody, you know, to help us to open it and then drop them into our kit. But for these purposes only, what we will do is we will pretend that this is in our kit. Okay? So I'm bringing it over to my kit and we'll pretend that it was already in the kit. So what we'll do is we're going to open the swab stick package, making sure that I'm stepping away because sometimes the liquid in these can drip all over your sterile field. Anytime your sterile drape gets wet, it is contaminated and you'd have to start over. Okay? So I've opened my swab stick package and I'm separating them so that way they're not stuck together when I get ready to use them. And then we'll place them in our kits. Okay? So now that everything is prepared and ready to go, I'm going to bring my kit over and I'm just gonna do this. So we'll pretend that I had already done that, just so it's a little bit easier when we insert it on the mannequin. Okay, so now we're going to get ready to bring this over to our sterile field. Okay, and notice how we're placing it within our sterile drape within the 1-inch margins. Okay, so again, it's an extension of our sterile field. So Miss Adams, we're going to get ready to start. So I'm going to touch your private region, your genitalia here, and we're going to get started to clean the area. Okay, so I am going to, just like we did earlier for the perineal care, I'm going to spread open the labia. My left hand is my non-dominant, which is now my non-sterile hand. Okay, so I am going to, everything that I need to touch with my sterile glove, it will now be with my right hand. Okay, because that is the only hand that is sterile at the moment. So I need to make sure that the labia are open. And I'm gonna, with my sterile hand, my right sterile hand, I'm going to grab one of the swab sticks and I need to clean from distal to proximal to medial. Okay, so top to bottom, one wipe per swipe. Okay, or one swab stick per wipe. So top to bottom, we're cleaning the labia, top to bottom. And when you have to come across, do it around the leg so that way you're not contaminating across your sterile field. Okay, that's a big no-no. So top to bottom, and then once you're done, you're going to come around and throw that away. So we're going to get our second swab stick, and now we're going to clean top to bottom proximal. Okay, so top to bottom proximally, one wipe, coming around. And again, if you have your little little trash bag that you made with the packaging, you can throw it there, just making sure that you're not contaminating. And then here's our third one. Now with this third cleansing, this third swab stick, you're going to be able to identify the urethra because you're going to see a wink. You're going to see like a little pop, kind of like when a bubble bursts, it kind of shimmers, it shines. That's what it looks like. Because in some women or some females, it'll be difficult to see that urethra, especially the elderly. So for this last one, we're going to clean top to bottom, go top to bottom, one wipe, and then we should see that little blip, which is the wink. Okay, so now that that's clean, I'm going to get ready. So Miss Adams, you're going to feel some pressure, okay, as I insert this catheter. So you're going to get ready to insert the catheter. So you want to hold it pretty close to the tip so you have a good good angle as well as good control. Okay, don't hold it from way back here because it's just going to flop all over. Make sure that you don't let go of the labia because if you do, you'll have to start over with cleaning. Okay, so we're going to get as close as we can to that urethra. Okay, and we're going to insert and make sure that it is in, and you should not feel any resistance. If you do, then you might not be in the right place. Okay, and we're going to insert until we see urine. Inches for a female patient, or 7 to 8 inches for a male patient. But generally our indicator is when you start to see urine. So you should see that urine coming out of the catheter. Okay, so once I see the urine return, I'm going to insert 1 to 2 inches more to make sure that I am truly in the bladder. Okay, because I could be right in the urethra, right near the bladder, but I'm not truly in the bladder. So once I've inserted 1 to 2 inches past the point of seeing that urine return, I am going to get my syringe here, and I'm going to inflate that catheter balloon. Okay, so we're going to inflate by pushing in that plunger. So Miss Adams, is there any pain or discomfort?
No.
Let me know if you do, okay? If you feel anything.
Thank you. Okay, yes.
Okay, so if that happens, it could be that we're still not in the bladder. So what you can do is insert another inch, okay? So we'll insert another inch, and then, so before you insert, you would want to pull out the sterile water from the balloon that you had already inserted. So pull that out, because otherwise you won't be able to further advance the catheter. So we'll withdraw it, we'll aspirate it, and then we'll advance another inch. Okay, so when we do that, we'll try it again. Any pain or discomfort, Miss Adams?
No.
Do you feel any pressure or anything?
No.
Alright, so it's looking good. So I'm going to finish injecting all the water into that catheter tip. And now I don't need to be sterile or anything, so I'm going to remove it. And for this next piece, I'm going to change into non-sterile gloves, because these gloves are full of iodine, betadine, lubricants. We were touching the patient's genitalia, so we'll change into clean gloves and do hand hygiene. So we're going to do that. So hand hygiene and gloves. Again, making sure that we're keeping our eye on our patient so she doesn't fall for safety purposes. So our next step that we're gonna do is we need to hang the bag on the side of the bed, because all that urine that we see in the bag, that's gonna backflow back into the bladder. So once it leaves the bladder, once it leaves the urethra, pretty much once it leaves the body, the urine is no longer sterile. So we wanna make sure that we don't give our patient a potty right at the beginning, okay? So to do this, you're going to hang the Foley from a stable part of the bed, okay? So do not use the side rails. We're gonna use this hook, okay? Some beds will have a specific hook that's closer to the bed frame, that's easier to use. So this hook over here is the one that we'll use, okay? And then you just hang it like this, and then you would have the alligator clip, which is going to be used for the linens. And we're also going to attach our stat lock, and you want to make sure that the stat lock is placed carefully, so that way it doesn't tug on the urethra, okay? So this specific stat lock is going to clip onto the Y ports here. Let me double check. Okay, should be okay. So it looks like a Y, and it'll clip on like so. Just make sure that you're not tugging on it too hard, because then it's going to cause injury to the patient. Okay. There we go. And I am going to, so for these purposes, we'll remove this piece and that piece, and it will stick onto the patient's leg. But I'm not going to do that for real, because that way we can demonstrate the removal. So I'm attaching it to the upper thigh and making sure that there's enough slack left, so that way the patient, when they're moving their leg, it doesn't tug on their urethra like that, okay? So you want to leave enough slack, enough room for them for when they're mobile, okay? Now, another important thing to remember is when you have to collect urine from the specimen, from the urine that you just got from the Foley, your Foley catheters are going to have, most of them anyway, will have a port, okay? So this catheter in particular has a port here that we're going to use to collect urine. You're also going to have a seal, so this seal keeps the catheter system intact and sterile, so that way we don't get contaminated. The other thing is, when you get the first urine that you get when you insert the catheter, it is sterile. So you can collect it from the bag itself, because the bag itself will be sterile at the very beginning. Once it's been sitting there for a little while, it is no longer sterile, so you cannot use this urine, okay? So to open this piece of the catheter bag, so I'm just going to show you carefully so that way I don't spill this urine. You're going to push down on these two clips to release it from this little holding chamber, and then there is a metal clip here, or clamp, that you push up on, and it releases that clip, and it will, there we go, and it will allow you to have your urine, so I would get my little cup, and then and this would be done at the side of the bed with this hanging, because again, you don't want that urine to reflux back. And so we would carefully collect that urine specimen as the bag is hanging from the side of the bed, okay? So we would make sure that that's filled up a little bit more, and then we would label it with the patient's information and send it to the lab. So that's one way to collect the urine specimen for the very first, the initial insertion. After that, what you'll need to do is you'll collect the urine. So we'll make sure this is connected back. Hold on. Just attach it there. So we would get some alcohol. You would clamp this tubing so that way the urine will collect in this area. And then we would need to wipe the hub of that port for 15 to 20 seconds, because we want to make sure that all the microbes have been removed, okay? So alcohol or CHG pads, whatever your facility has. Okay? So once that's clean, you'll get your 10 cc Luer lock syringe, and it will go into the port and it'll screw on. And then you'll withdraw the urine from the port. So we'll say this has urine, okay? Once you have your urine, you're going to place it in the cup, okay? Making sure that it stays sterile. So this would be like if they're doing a urinalysis with culture to test for any bacteria or any pathogens in the urine. So that's why it has to be sterile. And then once you've finished collecting the urine, then you would unclamp this. You want to make sure that this is intact, that it doesn't stay clamped, because otherwise all that urine is going to reflux back into the patient's bladder. And then we clean all of this up, throwing it away, and making sure that the patient's bed is in lowest position, side rails up ×2, call light within reach, and that we're making sure that we've taken care of all the things that we need to in the room while the patient is, while we're in there with the patient. So I'm gonna remove this, tear that off. But for lab purposes, you're going to be reusing the supplies here, so we will not be throwing that away or tearing it off. And we're just going to put this all in the trash so we can throw it away. And making sure that she is left in a comfortable position. Do you have any questions or any needs, Ms. Adams?
No.
No? So let me know if you start to feel any pain or discomfort, okay? Since the catheter itself is draining your urine, you might have the sensation that you need to go to the bathroom, that you need to pee, or empty your bladder, but remember that you have that catheter, so it will collect the urine. Let us know if you do have to have a bowel movement. That, of course, is different. So here's your call light, making sure that that's within reach. And let us know if you are having any other discomfort or any other needs, okay?
Okay, thank you.
You're very welcome. And thank you so much for your patience, and I'll be back in 30 minutes to an hour to check on you to make sure everything's good, okay? Alright. Alright, Ms. Adams, have a good day, okay? And then I'll do hand hygiene and alright, now it's time to practice. Hello again, future nurses. So we went over how to insert a Foley catheter, and now we're going to go over how to discontinue or how to remove a Foley catheter or an indwelling urinary catheter. So we're going to remove Miss Adams' Foley. She has been voiding pretty well, so we're going to see how she's able to urinate on her own. So in order to do that, we're going to verify the doctor's orders. We're going to make sure that we verify our patient. But first, I'm going to do some hand hygiene, and I'm going to put on my gloves before I go into her room. Okay. So I verified the order. You also want to bring your supplies, so you're going to bring in your 10 cc syringe, blunt tip syringe, which is going to be used to remove the sterile water from the balloon. And we'll come into the room. Hi, Miss Adams, it's Cynthia again. Hi.
Hi.
So great news. Dr. Forbes has ordered for us to remove that Foley, okay? So in order to do that, I am going to clean you up. I'm going to empty the urine that's in your bag, in the Foley bag, okay? And I want to make sure that I document how much output, and also the coca. So for the insertion, we need to document the number of attempts, how many or what the gauge size or the Foley size is, what the patient's response was, and if there were any complications. We're going to do the same thing with the removal. So we want to document the urine, what the urine looks like, so coca, so color, odor, clarity, and amount. So we are looking at the urine here. So it's bright yellow. I'm going to pour this out into a measurable cup. We don't want to use the amount here for accuracy. Okay, so I would do that. Empty it, put it, dispose of it in the toilet, the urine anyway. And then Miss Adams, I'm going to verify your name and date of birth. Can you please tell me your first name and your last name and your date of birth?
Daniel Adams, December 17th, 1971.
Okay, perfect. And do you have any allergies?
No.
No? Okay. So for this particular part, we're not doing anything or exposing her to any allergens, but again, as a standard rule of thumb, always verify their allergies as well. Alright, Miss Adams, so what I'm going to do is I'm going to put your bed up. So I don't hurt my back. I'm going to pull these covers back for you. If there is a lot of, if the patient is soiled or there's a lot of dirt or microbes, you'd want to wipe those off with the bath wipes like we used earlier, okay? So we would do that. And then the next thing that I'm going to do is, so I already emptied and assessed the urine. So I'm going to remove this from the stat lock. Get my new 10 cc syringe, blunt tip syringe, to go into the port. And right away you'll start to see that syringe start to fill up with the sterile water. But I'm going to gently pull on the plunger to expedite that water filling back up into the syringe. Pull on it gently, because if you pull on it too hard, it's going to wrinkle the balloon catheter tip, and then it's going to hurt the patient as it's coming out. Okay. Oops, I pulled on that too hard. So you should get about, if not the exact 10 cc's, you'll never really get the 10 cc's back, depending on how long that catheter's been in. You'll get about 9.5, okay, which is what I got back. And that just happens from like the water getting reabsorbed into the system. So once that is out, what I'm going to do is I'm going to pull on that catheter gently. Don't just yank it out. You want to do it carefully, because you're going to have some urine spillage. You can also get some wipes, some clean wipes, dry wipes, a towel, paper towel, to help with controlling, you know, if there's any spills. So I'm pulling it out gently, and as I'm doing it, one helpful way is to twirl it or curl it around my finger, so I have better control as it's coming out. And you're asking your patient if they have any problems, any pain, discomfort, and then as it's coming out, you want to assess, does it look intact, or does it look like maybe the catheter tip has been removed, like maybe it's come off, broken off, if the area around the catheter balloon has burst. So I'm going to show you real quick what the balloon looks like when it's inflated. So this balloon will sit in the bladder, and prevent the catheter from coming out generally. Okay, so this is the bladder, my hand is the bladder, and then the catheter tip is down this is the urethra. So you can see when we're tugging on it, it's secured. Okay, so there will be times where a patient will self extract the catheter. It could be because they're confused, it could be because their mental status is altered. So typically patients will not remove it themselves. It can cause urethral damage. So we're looking, when you remove it, you're looking at the tip to make sure it's intact, to make sure this hasn't burst, because if the balloon bursts, it will come out even when the patient sneezes or puts pressure to adjust themselves, like they're pushing down, bearing down. You'll see the wrinkles that can be caused by the balloon. So when you're withdrawing the catheter, when you're withdrawing the water from the catheter tip too fast, it wrinkles, and then it can cause damage to the urethra as it's coming out. Okay, so it looks intact. The patient didn't have any discomfort. We assessed the urine. Then we're going to throw that away. So there was 250 mLs of urine. It was bright yellow, no odor, clear. The clarity was clear, and we said the amount, which was 250. The patient tolerated well. There were no complaints, no complications, and everything else will get disposed of. And so we'll clean the patient if we need to again, and then we will we've thrown all this away. We'll put her back in bed. I'll change my gloves. We'll put her gown back down, bed covers back, so that way she's nice and comfortable. And then her bed in lowest position, so that way she does not fall. Her call light is within reach. And Miss Adams, I will be back in 30 minutes to an hour to check on you, okay? Do you have any questions or concerns?
No, thank you.
Okay. Let me know if you're having any problems, okay? You wanna come back and, assess every hour to make sure that the patient voids on their own. If they are not voiding within 4 hours, then you'll need to alert the physician or the provider, because that could indicate that the patient is retaining urine. You will do your assessment, to make sure that you have all your cues, all your pieces of your assessment to give to the provider when you're calling them with an SBAR report. So you may have to do like a bladder scan, you'll have to palpate the bladder, see if they're having any retention, and just ask the patient more questions. Alright, now it's time to practice.